Dr. Vandерзвалмен, you are famous with the successful implementation of the first ICSI technique in 1993. What, according to you, has changed in the treatment of heart after the first ICSI application?
Yes, first of all, I want to say we were the first one in the 93 with ICSI with testicular sperm, because the first ICSI with normal sperm was done 1 year before from the Free University of Brussels. But what has changed from that time on, we try now at the present to reduce the number of embryo for transfer, and we go in the way of single embryo transfer. This for this reason, we have to analyze different aspects. Transfer of one embryo means that we have to select the best embryo. So, in this field, now there are plenty of battery of tests to try to select embryos, but at the present, there is no test at all where we can, in an accurate way, say, okay, we can select, this is the right embryo that will give you a pregnancy. Not yet. Probably in the future, the genetic will help us in this way. But to select the best embryo, the best way until now for us in our center in Austria and in Belgium is to transfer the embryo on the 5th day. That means on the blastocyst stage, because this is the best day where already some embryos stop their development, and we can in a more accurate way select the best one. Selection of the best embryo means also producing good gametes and selecting the best gametes. So we have the oocytes and we have also the spermatozoa. So for the oocytes, there are also a lot of tests to select the best oocytes, but until now I would say there is not yet one test that we can say, okay, this is the right one. Then we have the spermatozoa, and now for the spermatozoa, there is one way to observe the sperm and to inject it, is what we call the IMSI. IMSI is a technique where we can observe the sperm in a higher magnification, but with a specific optic that we call the Normarsky optic, that permit to analyze the sperm more in a three-dimensional aspect. And what say the literature now is that a sperm that look normal with this technology has a better chromatin status as compared with sperm with large defect on the head. Well, next to the selection of embryos and gametes, that is the part, I would say, of the biologist, because next to this you have the part of the medical doctor, the transfer, the stimulation and all these things. But still in the biological part we have the cryopreservation of gametes and embryo, and this is also an important steps. And with vitrification we can say that it is a big improvement. So to conclude in this part, I would say that when we look back 10 years ago, a patient go to the doctor and ask, doctor, how many attempts I have to try to obtain a baby? But now, when we see that we can select better and better way the good embryo, we transfer only one. That means that we will cryopreserve more embryo, transfer them one by one. We can increase the chance of pregnancy. And the question will be, doctor, with one attempt, how many baby can I have one by one?
Okay, and you just now mentioned about vitrification. Yeah. This is your main area of research. And you also had a presentation on this topic on the 13th National Congress of the Bulgarian Association of Infertility and Reproductive Health. What are your main achievements in this field?
So sorry, vitrification is a very old story, I would say. We start already in the animal field, vitrification in 85 with the bovine and the mice. So we developed afterward this technique in the human, and we obtained the first pregnancy in 96, if I remember well, after vitrification of human blastocyst. Now, what is the future of vitrification? Because we can vitrify oocytes, sperm, embryos, and develop embryos at different developmental stages. Now, the future, I think, will be try to find other methodology to vitrify oocyte, probably, an embryo also, with special cryoprotectant, as we call the antifreeze cryoprotectant. This is one important topics for the future.
What is your personal opinion on the vitrification of oocytes at the age of mid-20s as a prevention of future infertility problems?
Yes, I think this is now a good option for a woman who want to cryopreserve their oocytes and get a baby when they're still healthy oocytes, because you have to know that with the age, the oocyte quality decrease, and mostly the rate of chromosomal abnormality increased after the year 36, 37. So now in USA it is true that there is increased demands from young women to cryopreserve their oocytes. In our country, in Europe, for example, this demand is lower, but still we are now some laboratory try to implement these facilities for patients, and for example there is a facilities in Austria called Ovita that try to propose to patients, young women, the cryopreservation of oocytes. Yes.
And today you had a visit at our clinic. What are your impressions from the facilities here and the organization of work?
First of all, I would say, if I look the facilities, this is two small labs, but very, I would say, very well designed to work in an easy way. This is okay. They have all the materials necessary to do IVF and the last technology. And what I just tell to Tanya when we left the lab is that the personnel is also very, very. I would like to work with these people because they listen very well what we tell them, and they listen to you. This is important also.
Yeah. And one final question: what are your impressions from Bulgaria? Or maybe from Sofia.
I would say I stayed 3 days in Bolniца. Yes, very nice for me. I work most of the time, 20 weeks a year in Austria, also in mountain place. But it's the first time I would say that I was walking so long in the snow. So I would say I like it very much. The people are very lovely in the hotel, all was very well organized. The social events, nice social events. And I spent good time in Bolniца. In Sofia, I would say yesterday we walked in the city and I had a good impression. I like very much the city, I would say, is large boulevard, large avenue. You feel that you have a lot of air. You're blessed. You have no. It's not like in other countries. Sometimes you are working and you have the impression that all the building will fall on your head. But yeah, it was nice. It was nice.
Okay, thank you.
You're welcome.